Gout is characterized by sudden severe attacks of pain, redness and tender in joints, often the joint at the base of the big toe. Gout, a complex form of arthritis, can affect anyone. Men are more likely to get gout, but women become increasingly susceptible to gout after menopause. An attack of gout can occur suddenly, often waking you up in the middle of the night with the sensation that your big toe is on fire. The affected joint is hot, swollen and so tender that even the weight of the sheet on it may seem intolerable. Fortunately, gout is treatable. There are ways to reduce the risk that gout will recur. Symptoms of gout. The signs and symptoms of gout almost always occur suddenly, often at night and without a warning. They include intense joint pain. Gout usually affects the large joint of your big toe, but it can occur in your feet, ankles, knee, hands and wrist. The pain is likely to be most severe within the first 4 to 12 hours after it begins. Linger discomfort. After the most severe pain subsides, some joint discomfort may last from a few days to a few weeks. Later attacks are likely to last longer and affect more joints. Inflammation and redness. The affected joint or joints become swollen, tender, warm and red. Limited range of motion. Decreased joint mobility may occur as gout progresses. Process of gout arthritis. Gout occurs when urate crystals accumulate in your joint, causing the inflammation and intense pain of gout attack. Urate crystals can form when you have high levels of uric acid in your blood. Your body produces uric acid when it breaks down purines, substances that are found naturally in your body as well as in certain foods such as steak organ meats and seafoods. Other foods also promote higher levels of uric acid, such as alcohol beverages, especially beer and drinks sweetened with fruit sugar fructose. Normally, uric acid dissolves in your blood and passes through your kidney into your urine. But sometimes your body either produces too much uric acid or your kidneys excrete too little uric acid. When this happens, uric acid can build up, forming sharp needle-like urate crystals in a joint or in surrounding tissues. That causes pain, inflammation and swelling. The risk factors. You are more likely to develop gout if you have high levels of uric acid in your body. Factors that increase the uric acid level in your body include: number 1, diet. Eating a diet that is high in meat and seafood and high in beverages sweetened with fruit sugar, that is fructose, promotes higher levels of uric acid, which increases your risk of gout. Obesity. If you are overweight, your body produces more uric acid, which greatly increases your risk of gout. Medical conditions. Certain diseases and conditions make it more likely that you will develop gout. These include untreated high blood pressure and chronic conditions such as diabetes, metabolic syndrome, and heart and kidney disease. Certain medications. The use of thiazides, diuretics commonly used to treat hypertension, and low-dose aspirin also can increase uric acid levels in your body. So can the use of anti-rejection drugs prescribed for people who have undergone an organ transplant. Family history of gout. If other members of your family have gout, you are more likely to develop the disease. Age and sex. Gout occurs more often in men, primarily because women tend to have lower uric acid levels. After menopause, however, women's uric acid approaches those of men. Men are more likely to develop gout earlier, usually between the age of 30 and 50 years, whereas women generally develop signs and symptoms after menopause. Recent surgery or trauma. Experiencing recent surgery or trauma has been associated with an increased risk of developing gout. Complications of gout. People with gout can develop more severe conditions, such as recurrent gout. Some people may never experience gout signs and symptoms again, but others may experience gout several times each year. Medications may help prevent gout attacks in people with the recurrent gout. If left untreated, gout can cause erosion and destruction of the joint. Advanced gout. Untreated gout may cause deposits or urate crystals to form under the skin in nodules called tophi. Tophi can develop in several areas, such as your fingers, hands, feet, elbow or Achilles tendon, along the backs of your ankles. Tophi usually aren't painful, but they can become swollen, tender during gout attacks. Kidney stones. Urate crystals may collect in the urinary of people with gout, causing kidney stones. Medication can help reduce the risk of kidney stones. Test and diagnosis. Test 12 diagnosis of gout may include a joint fluid test. Your doctor may use a needle to draw fluid from your affected joint. When examined under the microscope, your joint fluid may reveal urate crystals. Your doctor may recommend a blood test to measure the levels of uric acid and creatinine in your blood. Blood test results can be misleading though. Some people may have high uric acid levels but never experience gout, but don't have unusual levels of uric acid in their blood. X-rays imaging. Joint X-rays can be helpful to rule out other causes of joint inflammation. Ultrasound. Musculoskeletal ultrasound can detect urate crystals in a joint or in a tophus. Dual energy CT scan. This type of imaging can detect the presence of urate crystals in the joint, even when it is not acutely inflamed. But this test is not used routinely in clinical practice due to the expense and is not widely available. Treatment and drugs. Treatment for gout usually involves medication. What medication you and your doctor choose will be based on your current health and your own preferences. Gout medications can be used to treat acute attacks and prevent future attacks, as well as reduce your risk of complications from gout, such as development of tophi from urate crystal deposits. Medications to treat gout attack. NSAIDs include over-the-counter options such as ibuprofen, Advil and Mortin IV, others naproxen sodium, Aleve and others, as well as more powerful prescription NSAIDs such as indomethacin or indocin or celecoxib, Celebrex. Your doctor may prescribe a higher dose to stop an acute attack, followed by a lower daily dose to prevent future attacks. NSAIDs carry risk of stomach pain, bleeding and ulcers. Colchicine. Your doctor may recommend colchicine, a type of pain relief that effectively reduces gout pain. The drug effectiveness is offset in most cases, however, by intolerable side effects such as nausea, vomiting and diarrhea. After acute gout attack resolves, your doctor may prescribe a low daily dose of colchicine to prevent future attacks. Corticosteroids. Corticosteroid medications such as the drug prednisone may control gout inflammation and pain. Corticosteroids may be administered in pill form or by being injected into your joint. Corticosteroids are generally reserved for people who can take either NSAIDs or colchicine. Side effects of corticosteroids may include mood changes, increased blood sugar levels, and elevated blood pressure. Options include medication that block uric acid production, drugs called xanthine oxidase inhibitors, including allopurinol, pebaxostat, limit the amount of uric acid your body takes. This may lower your blood uric acid level and reduce your risk of gout. Side effects of allopurinol include a rash and a low blood count. Febuxostat side effects include rash, nausea, and reduced liver function. Medications that improve uric acid removal. Probenecid improves your kidney's ability to remove uric acid from your body. This may lower your uric acid levels and reduce the risk of gout, but the level of uric acid in your urine is increased. Side effects include a rash, stomach pain, and kidney stones. Lifestyle and home remedies. During symptom-free periods, these dietary guidelines may help protect against future gout attacks. Keep your fluid intake high. Stay well hydrated, including plenty of water. Limit how many sweetened beverages you drink, especially those sweetened with high fructose corn syrup. Limit or avoid alcohol. Talk with your doctor about whether any amount or type of alcohol is safe for you. Recent evidence suggests that beer may be particularly likely to increase the risk of gout symptoms, especially in men. Get your protein from low-fat dairy products. Low-fat dairy products may actually be protective, effective against gout, so these are your best protein sources. Limit your intake of meat, fish, and poultry. A small amount may be tolerable, but pay close attention to what types and how much seem to cause problems for you. Maintain a desirable body weight. Choose portions that allow you to maintain a healthy weight. Losing weight may decrease uric acid levels in your body, but avoid fasting or rapid weight loss, since doing so may temporarily raise uric acid levels. Alternative treatment. If gout treatment aren't working as well as you had hoped, you may be interested in trying an alternative approach. Before trying such treatment on your own, talk to your doctor to weigh the benefits and risk and learn whether the treatment might interfere with your gout medication. Coffee. Studies have found an association between drinking both regular and decaffeinated coffee and lower uric acid levels. Vitamin C. Supplements containing vitamin C reduce the level of uric acid in your blood. Talk to your doctor about dosage of vitamin C, and don't forget, vitamin C intake can be increased by eating vegetables and fruits, especially oranges. Cherries. Cherries have been associated with lower levels of uric acid as well as reduced number of gout attacks. Eating more cherries and drinking cherry extract may be a safe way to supplement your gout treatment, but discuss this with your doctor. Other complementary and alternative medicine treatments may help you cope until your gout pain subsides or your medication takes effect. For instance, relaxation techniques such as deep breathing exercises and meditation may help take your mind off the pain.